Welcome back to the show, surfers. I'm recording this intro from the Northern Beaches in Sydney. I am here for just over a week. If anyone has any guest contacts while I'm here, please let me know. Also, we'll be doing a road trip up the East Coast, up to Byron Bay. So if anyone has any contacts in Byron Bay that could be good guests, and of course anywhere along the way between Sydney and Byron Bay, let me know as well. That's Mike at surfmastery.com, or you can go to the Instagram and DM me there as well. Today's episode is about the human body. I've been studying health and fitness and human movement for a long time, and DNS is by far the most detailed and logical and effective system that I personally have discovered so far. It is infantile kinesiology. It is quite detailed and very rehab based. Anyone who's a trainer, therapist, coach should be looking into DNS, and this episode is all about that. Why is it relevant to surfing? Well, the World Surf League are using DNS instructors for their athletes, and so are a lot of other team sports. And it's been around for a long time, but it is just starting to become more and more popular, and for good reason. And in this show, you will learn all about it. With today's guest, Michael Rintala. Michael is a top-level DNS instructor and has been working directly with the WSL and their athletes. He has also been running courses on how the DNS principles apply to training athletes, in particular the surfing athlete, and that was where I met him on a DNS course, surf-specific DNS course. Over the next 40 minutes or so, you will learn a lot more about him, the DNS system, and how it applies to the surfing athlete. Michael, welcome to the show.
Thank you.
Can you give us just a quick rundown on your background?
Yeah, my name's Michael Rintala. I'm a chiropractor based out of San Diego, California, where I have a private practice specializing in sports medicine and rehabilitation. Besides my private practice, I spend some time, a little bit of time on the World Surf League Tour, the Professional Golf Tour, PGA. I'm also on the USA Surfing Performance Committee, and I am one of the international instructors for Prague School of Rehabilitation, teaching Dynamic Neuromuscular Stabilization, or DNS.
Mm-hmm. So what is DNS?
So DNS is based off of the concepts and principles of developmental kinesiology, which is the neurophysiological aspects of the maturing locomotor system. Basically, motor development after birth.
Mm-hmm. Originally, that's how we learn to move.
Yeah, that's where it all begins. So when we're first born, though, functionally and structurally we're immature. Our central nervous system still isn't mature. And when we're newborns, we're reliant on primitive reflexes, so grasp reflex, sucking reflex, startle reflex. Those help keep us alive. As our central nervous system matures, by 3 months of time, we have the ability to create synergy, coordination, and the timing needed to create stability through our trunk and pelvis. So that 3-month period of time is a developmental milestone. From there, going on to about 2 years, we have the central nervous system maturing in the subcortical region of the central nervous system, or the brain. And this is where our postural foundations are established. So from 3 months, we'll also have developmental milestones at 4 months, 5 months, 6 months, going from being on our backs or face down to being able to lift our limbs, our heads out of support function, and eventually being able to turn all the way over, crawling, kneeling, squatting, standing, eventually walking. So that kind of 3-month to 2-year period of time where we have that central nervous system maturation, and if that central nervous system maturation is healthy, we develop the hardwired motor patterns that we have throughout our lives. So we have that ideal quality of stabilization, ideal efficiency of movement. As adults, we have different head size compared to our body. We have different shape of our thoracic cage. We have different limb lengths. So there's differences that way from a infant to an adult, but we still have those same hardwired motor patterns that are manifest during that those developmental stages and with that central nervous system maturation.
Mm-hmm. That's a good explanation.
Kind of going deep there, but so Professor Kolaj, with his experience again as a pediatric physiotherapist and working with some of the top pediatric neurologists in the Czech Republic, came up with these concepts and principles, saw the aspects of developmental kinesiology and those developmental milestones in all human movement, even as adults. So with the knowledge of developmental kinesiology, the quality of movement and stabilization that he sees during that time, we can use that as that knowledge as assessment, treatment, and training for the adolescent or the adult athlete. So there's certain things that we can look for or assess as far as in the adult patient or the young athlete or just general public, as far as how their deep stabilizing system is, how efficiently it's functioning. And then based off of those assessments, we can utilize specific, what we call active exercises, positions based off of those developmental kinesiology milestones, specific points of support, specific activation of the deep stabilizing system, which is diaphragm, pelvic floor, the entire abdominal wall. We can utilize that knowledge and that example to help train more efficient transfer of force and load in the athletes that we all work with, whether you're a clinician like me or a trainer or a movement coach or a specific sports coach.
Yeah, no, I can speak from experience, both as a patient and as a trainer. A few years ago, I was in a state where I couldn't put my socks on without breaking into a cold sweat. My lower back was just in agony. My shoulder was killing me. I'd seen everyone. I'd seen multiple physiotherapists and physical therapists, chiropractors, acupuncture, massage. The list goes on. And then I was in New York at the time, and there was a DNS place there. And I walked in, no expectations. And they got me lying down doing this breathing exercise, and I thought, well, this is not going to do anything. What are you guys doing? And then I stood up 20 minutes later, and for the first time was pain-free. It blew my mind. And then I did some more sessions and fixed the shoulder, fixed the knee, and I was like, wow, there's something here. So that inspired me to dig deeper and study it, and now I'm using it with my clients, both with rehab stuff, and just the whole system inspires you to get far more detailed with technique and all other exercise as well. And it's just been mind-blowing. So I can speak on both those levels. So
yeah, that's excellent. And it's kind of my experience too, getting into this. I played competitive tennis growing up, and I played it in college. By the time I got to college, I was falling apart, tendinitis, I knees and shoulders, and basically overtraining, poor stabilizing strategies, and I ended up with what's called a spondylolisthesis, which is a kind of a fracture in your spine. And that kind of drove me in the direction that I've come to, which is being a chiropractor. And at that time, I went through everybody trying to figure out what was going on, trying to get better. And it wasn't till I actually went into chiropractic school kind of selfishly trying to figure out how I'm going to fix myself, because nothing was getting me there. And in school, I got introduced to the Prague School of Rehabilitation, which is where Professor Kolaj developed DNS. And it was one of the first times reading and looking at the material and the way of thinking that made sense. And then from that point on, I just pursued it. Eventually, I went over to Prague. This is like 2003, kind of dating myself, a long time ago. And since that time, I've just been, I got myself back to where I could do what I wanted to do and perform how I wanted to perform. And I just kept pursuing more knowledge, learning from Prague School of Rehabilitation, Professor Kolaj, and all the physiotherapists, to the point where I am now, where I'm teaching for them, and I utilize it with everything I do, whether it's my own activities or helping to rehabilitate my patients and train my patients. But the beauty that I see with DNS is it's not something that you have to replace everything you're doing. It's something that you can easily integrate to what the good work that you're already doing and just enhance that. Because, I was doing lots of good stuff. You were doing lots of good stuff. That was the piece of the puzzle that kind of put it all together to move us into the direction that we wanted to move in. And, for you, one of the main concepts and one of the main focuses of DNS is to focus on the function of the diaphragm, because it's a huge component in that deep stabilizing system, which is, again, diaphragm, pelvic floor, the entire abdominal wall. So six-pack muscles, oblique, transverse abdominis, also including the intersegmental musculature throughout the spine. When you have that synergy, coordination, and timing of that group of musculature, you have that ability to create a fixed point through the trunk and pelvis, which then helps create what we call joint centration throughout the kinematic chain. So like you said, you got your back under control, but then you started clearing up your shoulder and your knee and everything else that ties into that whole chain. So that ability of the diaphragm to function with both respiration, stabilization, and then coordinate between those two is a key factor where I see, especially my athletes, fall apart. And if I can help train them to get that back, then it's huge, not only for their stabilizing strategy and helping get rid of pain, but there's also a huge enhancement in the efficiency of movement, transfer, and load, which heightens their performance or increases their performance potential.
Yeah, it sure does, and I've seen that with plenty of my athletes.
Right.
Yeah, and they're blown away. They can't even make sense of it.
Right.
But yeah,
it's at first. I mean, when we were talking before. You're talking about with your rugby athlete and just working on the breathing. They're like you experienced. You're like, what is this going to do? But that breathing component, that respiratory component of the diaphragm, mimics the stabilizing strategy as well. So when we go to move, before we even move, the diaphragm's going to descend. It's going to create this intra-abdominal pressure that eccentrically loads the pelvic floor, eccentrically loads the entire abdominal wall, creates an unloading, uprighting throughout the spine. So if we can improve the respiratory function, which when we take a breath, the diaphragm descends as well, then automatically we're improving the function of stabilization. And if we do that and we get the coordination between both, then we improve that efficiency of movement, stabilization, as well as respiration, and lots of good stuff happens with that.
Yeah. You can't fire a cannon from a canoe.
Right. You need that base.
Yes.
And that's the thing. It's when that synergy, coordination, timing of deep stabilization provides a fixed point for the larger muscle groups in the body. If you don't have that, if you lose that efficiency, you can still move, you can still function, you can still get the job done, but you're using more of a high threshold compensatory pattern. And when you do that, you start to overload the passive structures throughout the kinematic chain, the transitional areas throughout the spine, and you lose that full potential for transfer of load and force and performance. And you kind of beat yourself up in the process. So what I see is, there's plenty of really good athletes that are successful that don't have the efficiency of that deep stabilization like the Roger Federers or the Kelly Slaters, those athletes that really rise to the top, the Marcelo Garcias of Brazilian Jiu-Jitsu. Those athletes that naturally have that ability, you see them rise to the top. They do get injured, but it's not as often, and they don't stay injured as long as the other athletes, and their durability and longevity within their career tends to be longer. So you can still be a very good athlete, very successful, but if you don't have that quality that can be trained, that can be assessed, then maybe your career isn't quite as long, maybe you're injured more often. And this goes not only with athletes, but just the general public as well. People trying to work out, they'll start working out hard, they get hurt, they stay hurt, finally things calm down, and then they continue this cycle of trying to do that. So in the general public, or with collegiate, junior athletes, not on necessarily the pro level, we can still be effective, we can still help them get more durability, more longevity, enhance performance. Maybe they're not making their living off of it, but we can still help them with playing and enjoying it.
Yeah, longevity is a big one.
Yeah.
Yeah, and in terms of like the surfing workshop that we did a few months ago in Huntington, some of the pictures of the way the baby is standing and compared with the way the Kelly Slater is standing in the barrel is just uncanny, right?
Yeah. So with that, that's what Professor Kolaj recognized working with pediatrics, is in these developmental milestones, you see the squat position, you see the lunge position, turning from supine, rolling over to your stomach. That's a turning sequence. So when you're making the bottom turn, on the wave, and then coming up and coming off the lip, that's part of that turning sequence. And you'll see that, again, that same quality, that same motor function that we see during developmental kinesiology within the surf athlete and with everything that they do, but also within the runner, within the soccer player, within the tennis player, within the weightlifter. So it's really that those developmental milestones are the optimal fundamentals that if we can keep that pure quality of motion, then we're going to be really successful with our movement. What happens, though, is, especially, as adults, especially as we start getting into school, there's certain things that mess it up. One, postural habituation, repetitive sitting, repetitive, or just sitting in the driving position, whatever you're doing day in, day out. Repetitive movements. So our athletes doing the same maneuvers, same actions over and over. Injury can affect that synergy, coordination, and quality of timing of that deep stabilizing system. And if you're dealing with an athlete, usually you're looking at all three. So it's something, again, with the DNS coursework, we work on specific assessments to recognize those insufficiencies. If you're in the clinical track, we work on specific manual methods to help facilitate better quality of stabilization. And with the exercise track, sport track, we're looking at assessments, ways to cue, and ways to utilize the active exercises to enhance that quality of stabilization and movement.
Well, so you mentioned like good posture and good technique. It's not only unique to surfing; it's ubiquitous through all athletics.
Yeah.
Like you look at the way Roger Federer steps forward to make a shot, and it's the same way that a surfer might move through a top turn, for example.
Right.
So,
right.
Then you look at the similarities between how the infant develops, and you see it.
Right. So, in the class that you were in, if you remember, I showed the video of Kai Lenny getting up on, paddling and then coming up on this monster wave. And within that whole sequence, you could see a 3-month position, a 4 and 5 month developmental position, and then hopping up to a 12, 13, 14 month squat, oblique squat, while he's on the wave. And then kind of going through that turning sequence, but then also going into the squat position, ducking to when the barrel comes over him. So, yeah, whether it's a surf athlete or the tennis player, the jiu-jitsu athlete, you see those developmental positions within all the movements. So it makes sense to utilize that knowledge of developmental kinesiology to assess, to treat, and to train to help the people that we work with.
Yeah.
Yeah.
Yeah, it's ubiquitous to all sports.
Yeah.
It's human movement.
It's So,
and it gives rise to not only performance but longevity and good technique, and also just the way you look. Like, it doesn't look right if you're not
Right.
If your skeleton's not organized correct,
Yeah.
it looks more graceful if you're standing nicely and relaxed and
Yeah.
efficiently, etc.
So you look at the athletes like Michael Jordan, again, Kelly Slater, Roger Federer, these athletes that not only perform at their top, but have performed for a long time and have that durability. They're beautiful to watch, and there's a reason they have that nice quality of movement. They're able to move fluidly. They're able to relax when they need to. They're able to explode when they need to. They make it look easy, basically. When you see that, you see that inherently they've been able to maintain that quality of movement and stabilization since those developmental milestones. Athletes like that, they're still going to fall into postural habituation, repetitive movements, and injury. So if you can utilize the DNS concepts and principles on that type of athlete, they respond so quickly. And athletes in general, they have really good cortical function, meaning they can intake their environment, process it very well. And if they have that good cortical function, optimal postural foundations, they're going to do very well. Now there's other, there's psychological factors and other factors that will affect, quality of performance. But those athletes with that good cortical function or body awareness respond beautifully to the DNS assessment and treatment and training. But the real challenge as a practitioner or a trainer is to take that athlete that doesn't have that, who's maybe lost it because they've been relying on high threshold compensatory strategies, and being able to help that athlete. Because those athletes, maybe they take a little bit more time, a little more effort to get the feel of it and improve that efficiency of quality of stabilization and transfer of force and load. But they see huge improvements when you're able to help them. And one of the aspects of DNS is, we're going to train respiratory postural function of the diaphragm. We're going to train better synergy coordination and timing of deep stabilization. But we're also going to help them get better body awareness. There's specific things that we will do and utilize to help train that. And if they can train that, and they can train their awareness and their feel of activation of that deep stabilizing system, then they will be able to keep that. And they will be able to train in a way where that becomes automatic, subcortical, which is what we see again during the developmental process. So part of the aspects of utilizing DNS is to help train that awareness so that they can once they've trained it, once they have that quality, then they can just react, which is, as an athlete, you don't want to be thinking about, I have to activate here and put my foot here and do this. You want to just perform. But in order to do that, we can help them get those fundamentals, kind of wake up or get those hardwired motor patterns that they still have from the developmental milestones to manifest as adults. And so that's the big thing. We're not necessarily training hypertrophy or muscle strength, but we're training the central nervous system. And when you have that synergy, and when you can tap into those hardwired genetic kind of programs that again are manifest during that central nervous system maturation, then you create the synergy. And the synergy is where you get that real power, and you get that fluid, efficient, effortless motion, but effective motion and effective transfer of force and load. So that's kind of the main aspect of DNS, and that's why I find that it integrates so well with, if you're a strength coach, if you're a movement coach or a movement specialist, you add this aspect of it, and it's like you're upgrading the software, and you're enhancing that ability to utilize the things that you're already doing.
Yeah. Well, you mentioned the word training and upgrading, but is it maybe more specifically, it's not necessarily that you're learning something new, you're just rediscovering something that's already there.
Exactly. So what happens if, with movement, and especially with athletes, we have kind of what's called a functional capacity, like our ability to maintain that quality of movement and transfer of force and load, that synergy, coordination, and timing of deep stabilization. Now, as athletes and when we're training, our tendency, or kind of our goal, is to go past that. And we go past our functional capacity, our ability to maintain ideal. Then we go into what's called the functional gap. So we got to push to help raise the ceiling of functional capacity. But so if we dose it right, if we dose our training right, and we have good technique, we can do that. But if we spend all of our time in the functional gap, if we're constantly pushing past our capacity, then we're training compensation patterns. We're using more high threshold strategies, which still is going to get the job done, but that has a toll on the passive structures throughout the body. We overload the joints. We overload the transitional segments of the spine. By utilizing DNS, we increase that ability to stay within your functional capacity. You're still going to push into the functional gap, but it won't be as often. And when you do, you'll be able to integrate that and heighten the full functional capacity, the full efficiency of movement, so that you don't overload the passive structures of the body, and ultimately you have a higher performance potential. Because if you're always in the functional gap, you're always using high threshold patterns, there's going to be more injuries. Those injuries are going to keep you from training. So your ultimate peak performance will be compromised. You can't quite reach that full potential. So another main goal is to train that function, that those help manifest or wake up those quality patterns, and then train them to a degree where you can stay within that ideal transfer of load and force, and not only, again, have the potential to decrease injury, but enhance performance.
Yeah.
Yeah.
And for me, it's about the details too, isn't it? And it's not just relevant for trainers and clinicians. I think it's also relevant for just anyone who's a coach who assesses technique, because this is human movement and it's the most efficient way to move, and it's relevant to all techniques of all sports.
Right.
But the secret here is it's not about it can be, the more detailed you are, the more powerful it is. Like for me, like having a good practitioner shift my pelvis 4 millimeters just changes the game.
Right.
Like 2 millimeters sometimes. It's like takes you from being in an easy position to being in a hard, the whole body's fired up and I get out of pain sort of thing. It's amazing.
It allows you to perform. And, talking about coaches develop their eye, whether it's a surfing coach, whether it's a track coach, pitching coach, a batting coach, they train their eyes to see technique faults, and they can talk to their athletes about those technique faults, give them cues to correct. One thing, if you help facilitate better quality of stabilization and what we call joint centration, position of the joints through a full range of motion throughout the whole kinetic chain, then if you do that, you're going to be able to get in the positions that the coach wants. You're going to be able to do the motions or put the effort out that the coach wants. A lot of times, coaches will come to me and say, okay, this is what's happening. Like, a golfer, they're not getting back on their golf swing. They're getting stuck, and then they're opening up, and then they're not being able to, rotate through the hip. And if I address the quality of stabilization and joint position and transfer of force and load, then without even giving them technique cues, their technique starts to improve. So then the coach they go back to their coach. The coach gives them these cues, and now they can get into the position that the coach wants them to get into. So it's not only for clinician and trainer, but again, coach and movement specialist. They can utilize this knowledge. They can utilize the assessments to see the insufficiencies, and then if they address them, or they send them to the movement specialist or the strength coach or the clinician or rehabilitation specialist to address those issues. When they come back to them, it makes their job a lot easier. And it's that teamwork, or that working, the coach working with the strength and conditioning specialist who's also working with the rehabilitation specialist, that's going to be better for the athlete and for the person that wants to achieve their goals.
Yeah, and like I said before, it's easier to learn than you think because you're not learning, you're rediscovering.
Yeah. One of the questions I get is, well, and I kind of addressed it at the beginning, is, we don't have the same body types as the infant, so why are we going to move like the infant? And that's a common theme. And I come back with what I said in the beginning. It's like, yeah, we have different proportions, our head size, our thoracic cage shape, our limb lengths, our pliability, our mobility. That's a factor, but we still have those hardwired ingrained motor programs, and if we enhance those, we can enhance that ability to move with the quality that the infant was moving with during that developmental time. So, yeah, I've been practicing over 20 years now, and it's one of the things that is a key part, obviously, of what I do, and I've been able to see the results over that time. Now I utilize other things. I do specific soft tissue work. I mobilize because I'm a chiropractor, and all that will enhance what I'm trying to do with the DNS. But I also, have specific strength and conditioning coaches that I will send people to, because I know that they're going to continue that process of quality over quantity and keep that synergy, coordination, and timing of the deep stabilizing system. And then if I can talk to the coach who also understands what I'm doing, that's going to again be the best synergy to help that athlete succeed.
So your experience working with elite surfers, how's that been? What have you come across? Any common injuries, common objections?
Yeah. So one, they're great to work with. Just as a group, I love working with them. Just their attitude and their motivation and their work ethic. So common things: low back, neck, shoulder, knee, ankle. Especially now with everybody's doing more and more aerial maneuvers, and the landings are there's more kind of traumatic injuries. So a lot of the low back, hip is a big one. Low back, hip, shoulder, neck is with their repetitive postures, repetitive movements, paddling and popping up, and then doing the movements on the wave. You see them kind of going past what they're being able to maintain that functional capacity. So you'll see them utilizing more compensatory high threshold patterns, and you see more overload in the low back, in the neck and upper back area, in the shoulder, in the hip, because that affects, again, the loading in those areas. So with the repetitive nature of the movements and postures, those are the main areas that I see. That can, again, also affect performance. If we don't have that ideal quality of stabilization, we're not going to have the ideal quality of support function of the foot, of position of the knee, hip, and pelvis. So if they develop these compensatory patterns and lose that optimal ability to support as they come up, launch off the wave, go into their 360 backflip, and then land in not optimal positions, then we're also increasing that risk for those traumatic type of injuries, with the aerials and with the landings. So you need that quality not only for the repetitive type injuries, the tendinitises and the disc injuries and everything else, but you need that quality for the dynamic aerial explosive maneuvers that they're doing as well.
Especially even just the 3-month position, using the principles of that to whether you lie on a surfboard.
Yeah.
Can change the game.
Yeah.
And then, obviously sometimes we're doing some pretty fast pop-ups. So you've got the 6-month and 7-month position, which getting stable in those can help the speed and efficiency of your pop-up and save that lower back.
And, talking about paddling, I mean, that's what we're doing most, actually, when we're surfing. So, having that quality, you're going to be able to get to the wave quicker. You're going to be able to, if you're competitive, beat out your opponent. Or, if you're competitive in the lineup, you're going to be able to get that wave quicker than the other guy or gal. So it's a huge component because everybody thinks of, the bottom turn, off the lip, and the aerials. But you got to be able to get to the wave and get in the position that you want to get to then do all that amazing stuff.
Awesome. So, can you tell folks where you're working from?
I work out of a place called Function Smart. It's a physical therapy facility. I'm independent, but within San Diego, California. It's by La Jolla, Del Mar. People would know that.
It's about, 5 minutes inland from Blacks?
Yes. Good one. Yeah. As far as, so I work out of here and I see patients, all sorts of athletes, surfers, golfers, tennis, football, baseball, but I see general population as well. And we do courses here. We actually have a course coming up in 2 weeks. We're integrating kinesiotape with DNS, which is a really cool one for anybody that utilizes the kinesiotape.
Is that with Tim Brown?
With Tim Brown, yes. Yep. Yeah, Tim Brown and Steve Capabianco with Rock Tape, Tim Brown with IntelliSkin. So I'm really excited about that one, to be able to integrate and collaborate with them, because those are two great minds. And again, it's kind of illustrating that point of how we can integrate with other approaches and other techniques and other tools to enhance what we're doing. And then in March, there's a running specific one coming up in December. I'll be teaching in Japan, and then I go right from Japan to Hawaii during beginning of December during the competitions then. And the 10th, 11th, 12th, we're doing a sport-specific one, and that's with Chris Prosser from Australia, who's with the WSL.
Yeah, I'll put links to all of this stuff in the show notes and on my website. So.
And so that'll list the upcoming stuff. But that's going to be a really nice one. Location alone, and then you took the DNS surf specific one.
Yep.
And
you're going to do that again?
We'll probably do that at some point next year. We don't have it solidified yet, but we are actually, at least for the U.S. But in February, beginning of February, I'm going to Gold Coast in Australia, and we're doing a DNS exercise 1, followed right by a specific athlete movement preparation. There'll be like a specific focus on the surf athlete, but also open to every other type of athlete that you may work with. So the Gold Coast, and that's with Rodrigo Perez, Berthona Perez with Holistic Health.
Yep.
And he was at the one that you were at. And his, he trains a lot of surfers and does a lot of different movement strategies. So it's a nice combination to combine those two.
Yeah.
And with those, I'll give you a link to that one as well.
Yes, as soon as those listeners, as soon as that stuff has been confirmed, I'll share all of that on Instagram, and I'll make sure, to share all your stuff so people can just keep an eye on my Instagram, and I'll mention it on the relative pre-show shows as well. Awesome, man. Well, thank you so much for your time. Really appreciate it.
Thank you.
All right.
I love sharing this stuff, and I'm glad that you got so much out of that initial course, and I think as you keep working with it, you'll get better and better and get more and more out of it.
Yeah, no, I want to help share this because people need to know it. So
thanks for the opportunity.
All right, thank you.
Thank you.
I'm a dreaming man, yes, that's my problem. I can't tell when I'm not being real. In the meadow dust, I park my Aerostar with a loaded gun and sweet dreams of you. I'll always be a dreaming man. I don't have to understand. I know it's alright. I see your curves and I feel your vibration. You dressed in black and white, you lost in the mall. I watch you disappear past Club Med vacation. Another sleepless night, a sun that won't fall. I'll always be a dreaming man. I don't have to understand. I know it's alright. Now the night is gone, the new day is dawning. In our homeless dreams, go back to the street. Another time or place, another civilization. Really make this life feel so complete. I'll always be